Hello, class. My name is Guadalupe Pichinte, and today I'll be talking about alcohol. We will be discussing a short history about alcohol, and then we'll go into what exactly is alcohol, its effects on the body, and its consequences. So, fermented beverages have been tracked back to early Egyptian civilization, to China around 7000 BC, and India between 3000 and 2000 BC. In the 16th century, alcohol was used largely for medicine purposes. At the beginning of the 18th century, the British passed a law encouraging the use of grain for distilling alcohol. Cheap alcohol fooled the market and reached a peak in the mid 18th century. In Britain, gin consumption reached 18 million gallons and alcoholism became widespread. In the 19th century, it brought a change in attitudes and the temperance movement began promoting the moderate use of alcohol, which ultimately became a push for total prohibition. In the 1920s, the US passed a law prohibiting the manufacture, sale, import, and exportation of intoxicating liquors. By 1933, this law was canceled due to the illegal alcohol trade booming around the world. Today, an estimated 15.1 million Americans that are 18 years or older suffer from alcoholism, yet only 1.4 million seek proper treatment. Additionally, alcohol accounts for 88,000 deaths in the US each year, which drunk driving accounts for 40%, or 35,200 deaths. So, what is alcohol? Alcohol is a drug. It is classified as a depressant, meaning that it slows down its vital functions, resulting in slurred speech, unsteady movement, disrupted perception, and an inability to react quickly. As for how it affects the mind, it is best understood as a drug that reduces a person's ability to think rationally and distorts his or her judgment. Although classified as a depressant, the amount of alcohol consumed determines the type of effect. Most people drink for the stimulant effect, such as a beer or a glass of wine taken to loosen up. But if a person consumes more than the body can handle, they then experience alcohol's depressant effect and lose coordination and control. Alcohol overdose causes even more severe depressant effects: the inability to feel pain, toxicity where the body vomits the poison, and finally unconsciousness or worse, coma or death from severe toxic overdose. These reactions depend on how much is consumed and how quickly. There are different kinds of alcohol. Ethanol alcohol, or ethanol, the only alcohol used in beverages, is produced by the fermentation of grains and fruits. Fermenting is a chemical process whereby yeast acts upon certain ingredients in the food to control alcohol. Fermented drinks such as wine and beer contain 2% alcohol to 20% alcohol. Distilled drinks or liquor contains 40 to 50% or more alcohol. So the alcohol and its effects on the body. Drinking too much on a single occasion or over time can take a serious toll on your health. Here's how alcohol can affect your body. Alcohol is absorbed in the bloodstream via small blood vessels in the walls of the stomach and small intestine. Within minutes of drinking, it travels from the stomach to the brain, where it quickly produces its effects, slowing action of the nerve cells. Approximately 20% of alcohol is absorbed through the stomach. Most of the remaining 80% is absorbed through the small intestine. Alcohol is also carried by the bloodstream to the liver, which eliminates the alcohol from blood through a process called metabolizing, which is converted to a non-toxic substance. The liver can only metabolize a certain amount of alcohol at a time, leaving the excess circulating throughout the body. Thus, the intensity of the effect on the body is directly related to the amount consumed. When the amount of alcohol in the blood exceeds a certain level, the respiratory system slows down markedly and can cause a coma or death because oxygen no longer reaches the brain. So the brain is usually causes loss of memory and hallucination, fits, and dementia. It usually causes slower breathing and can cause cirrhosis in the liver. It usually causes the muscles to lose its control, and of course, it causes the enlargement of the heart, high blood pressure, and irregular pulse. So, harmful and underage college drinking has become a significant public health concern. Drinking in college has become a ritual that students often see as an integral part of their higher education experience. Many students come to college with established drinking habits, and the college environment increases the problem. According to the national survey from the NIH, or the National Institute of Health, almost 60% of college students ages 18 through 22 drank alcohol in the past month, and almost 2 out of 3 of them engaged in binge drinking during the same time frame. As you can see in the screen, short-term health risks include injuries such as motor vehicle crashes, falls, drownings, and burnings. It also includes violence such as homicide, suicide, sexual assault, intimate partner violence, which those are the most common for college age students, and then alcohol poisoning and also reproductive health. It increases the risk on sexual behaviors, unintended pregnancies, sexual transmitted diseases, including HIV, miscarriages, stillbirth, and fatal alcohol spectrum disorders. Some of the long term health risks include chronic diseases such as high blood pressure, heart disease, stroke, liver disease, digestive problems, cancers such as breast cancer, mouth and throat cancer, liver cancer, or colon cancer. Some of the things that it also causes is learning and memory problems such as dementia and poor school performance, mental health disorders, which in depression and anxiety, social problems such as loss of productivity, family problems, and unemployment. And it can lead to alcohol dependence. The consequences not only affect the students, but their families and their peers in college communities. And those are my reference. That is it. Thank you.